Bismillah, Salman.
Assalamu alaikum, peace be upon you all. Good evening and welcome to this webinar where we are going to be talking with the Palestine Children Beliefs Fund alongside us at the British Islamic Medical Association. Thank you all for joining and really looking forward to a wonderful conversation that we're going to be having with our panelists, Princess Dina, Dr. Hassan and Dr. Mads, who you'll be hearing from in a moment. I'm Salman Vakar. I am a GP and the president of the British Islamic Medical Association. And just before we begin, I'd like to give a very brief overview of the work that we've been doing, both in relating to Palestine, but also generally what we've been doing for Muslim communities in Britain. So we are a network of Muslim health professionals across the country. We're independent, we're apolitical, and our goal is to promote the contributions of our healthcare community, but also to address some of the health inequalities facing the communities that we're also part of. Next slide, please. And we aim to unite, inspire, and serve. That's our motto. And we try and do that through the platform that we've created and really recognizing that we have a lived experience that is crucial in not only our population inequalities, but also those of our workforce. We have three main themes, which are listed on the slide there, which look at various aspects of both population and workforce issues. As it pertains to the issue in Gaza and Palestine, that's mainly around the lens of Islamophobia and advocacy. And I just wanted to spend a moment talking about the work that we have been doing in that space. But before I do, I wanted to ask colleagues to really think about if you haven't already joined BIMA, if you are a Muslim health professional in the UK, do consider joining us to be part of that network, to allow your voice to be heard in the platforms that we are in and in the rooms and the corridors of power that we are able to influence and really invest in a brighter future, not just for ourselves, but also for everyone else. We know that when the least privileged and the most deprived people in society are thriving, everyone else is also finding that things are better for them as well. And the way you can do that is by going to our website, britishima.org/membership, where you'll have lots of information about who we are and how you can also join. Next slide. As I mentioned, in terms of the work that we'll be doing around Gaza, we initially surveyed our membership. We have over 7,000 health professionals who are formerly members of BIMA. And we found that, unsurprisingly, the vast majority of them were finding that the crisis in Gaza was adversely impacting their health. And not only that, regrettably, they were finding that their employers and institutions were not providing them with the support that they needed to be able to articulate themselves safely and openly. And we've had this survey published in the British Medical Journal, and further work is forthcoming in this area as well. Next slide, please. And we've also been looking at providing guidance to members around how to express your views, given this heavy censorship that we are seeing and difficulty in people finding the language to do so without getting harassed and intimidated and bullied by people in not only in social media, but also in the workplace as well. So we've done a series of webinars looking at well-being, looking at understanding what are the issues that colleagues are facing and trying to engineer solutions for them. And just some of the examples here on the slide just show you the types of work that we've done. Next slide, please. And we've also been writing to and speaking to parts of the medical and political system within the United Kingdom, whether that's unions, whether that's regulators, whether that's other bodies that are involved in this process to try and get them to understand the issues facing Muslim health professionals, but also generally those that are pro-Palestinian and really wanting the conflict to end, pro-humanitarian perspectives, which are unfortunately not given the privilege, not given the same opportunity to have their voices heard in public and also in professional spaces. And not only that, given the double standards that we have seen in response to previous conflicts, particularly Ukraine, and how the medical institutions have not risen to the occasion as they did just a few months ago. We've also been supporting fundraising as well, and we hope that we can continue to do that with the PCRF. Soon after the Gaza crisis, we're very grateful that colleagues raised over £33,000 for medical aid for Palestinians. And because of the work that we've been doing around supporting health professionals, we've also put an appeal out there where we have raised legal funds for colleagues who, again, are finding themselves disproportionately and unfairly targeted on account of their advocacy for Palestine. Next slide. We've also put forward a support service. So if anyone here on this call, either themselves or they know others who are finding themselves in difficulty, either because of legal issues or because of their well-being, there's a number there, there's an email there which you can contact in confidence. And we're also organizing events. This next event that we've got coming up on the 1st of May is with the 3 main medical defense unions in the United Kingdom, where we're going to be talking about what they can do and what more support they can potentially offer for colleagues who find themselves in difficulty as a result of this situation. Next slide. And I just wanted to end by mentioning that we also do networking events, and our conference is coming up in August, where we are delighted to yet again welcome Dr. Ghassan, inshallah, who will be speaking about the lessons from Gaza at the University of Warwick on the 31st of August. There's also a promotion code, which are there on the screen. If you get 3 tickets, you get 1 free. Again, all of these details are on our website, britishima.org. And you can also follow us on social media at BritishIMA. That's it from us. Thank you very much for listening very patiently. I now want to introduce to you our host for our conversation that we're going to be having with colleagues at PCRF, and that is Vivian Khalaf. She is an immigration attorney who has been living and working in the United States for the last 35 years. And she has a long history of advocacy for human rights and social justice for all peoples. And she's a member of several legal bar associations and is based with the Arab American community in the United States, having served on several boards in the States, including PCRF, since 2019. And in the last year and a half, she has had the privilege of serving as their chair. Vivian, thank you so much for chairing the next part of our conversation. I'm going to hand over to you to introduce our speakers and also chair the question and answers. Thank you very much.
Thank you. Thank you very much, Dr. Waqar. Thank you to BIMA for initiating this relationship that we are really looking forward to. And it says a lot when someone initiates a relationship, especially during these unprecedented times. So our hats off to BIMA and each and every one of the physicians and organizers of this webinar. Again, you've introduced me, and thank you for that kind introduction. I would like to, perhaps before we introduce our panelists who really need no introduction, to start with the introduction of the organization first. If you can please move to the next slide. And we don't want to do too much talking. We want to hear from our panelists, and we want to respect everybody's time. So please take just a few moments to listen to the video and understand who we are and why we're here. So please, if you can begin the video.
PCRF, the Palestine Children's Relief Fund, is a nonprofit humanitarian organization established in 1992 by a group of concerned humanitarians here in the United States. Our mission is to provide medical relief and humanitarian aid to all children across the Levant, regardless of their nationality or religion. We envision a world where every child has access to quality medical care, humanitarian aid, and specialized surgical procedures. Since its establishment, the PCRF has sent over 2,000 affected children abroad for free medical care. We have also sent thousands of international doctors and nurses to provide tens of thousands of children the medical care they need in local hospitals, as well as humanitarian aid and support that they otherwise would not have received. Our impact also includes establishing 2 pediatric cancer departments in Palestine, one in Gaza and one in Beit Jala, as well as a new PICU, and Pediatric Cardiology Department in Ramallah, along with many more critical projects to sustainably bolster the region's healthcare system. Since October 7th, when this ongoing tragedy began to unfold, the PCRF has dedicated its resources and focus on providing humanitarian relief to our children and families in Gaza. And to this date, we have provided over $10 million received from generous donors all over the world. This relief has included nutritional intervention, hygiene supplies, medical supplies, water, blankets, tents, and other urgently needed items. We call upon humanity and all those that are listening to me to please do what you can, offer your help in whatever way possible to help alleviate the suffering of our children and families of Gaza.
Okay, thank you. I'm going to go through several slides, and we're going to start with this one. I just want to remind everyone that the tragedy that has continuously engulfed the Palestinian people has been ongoing for almost 75 years now. This did not start on October 7th. PCRF has been on the ground in Gaza and in the West Bank for over 30 years. But unfortunately, the focus now is on that particular date, October 7th, and our staff, those that we continue to be in communication and in contact with, which are 5 to 6 out of a total of 51 staff in Gaza, have been administering humanitarian relief since October 7th. So I just wanted to make that point, because often we start from October 7th as the point of departure. And I'm hoping that all those listening to me realize that that is in fact not the case. But in any event, that video just summarized who we are. I'd like to highlight that we are a US-based organization, a nonprofit, non-political, 501c3 tax-exempt organization that is board managed, not member managed. We are managed by a board of directors. Two of our main other subsidiary boards are the Technical Advisory Committee and the Medical Advisory Board. Our revenue stream comes from abroad, and we spend our money and minister aid within Palestine, Jordan, and Lebanon. Next slide, please. And these are our board of directors. Our articles of incorporation and internal governing documents allow for a 13-member board. We are currently at 9. Our board members sit in the United States, in the UK, in the Arab Gulf, and Jordan. So we are geographically dispersed across the world. And you have them here. You can certainly know more about them if you go to pcrf.net. Next slide. This is our newly established Technical Advisory Committee that is headed by Her Royal Highness Princess Dina Mir'ad, who you will be hearing from in a few moments, the distinguished Dr. Ghassan Abu Sitta, and several other distinguished individuals are now serving in an advisory capacity, assisting the board in certain technical areas which are needed. They possess a wide range and variety of skills and augment the board as needed. Next slide, please. This is our Medical Advisory Board or Medical Advisory Committee, headed by a maxillofacial surgeon, Dr. Ahmad Tamimi, and a radiologist, Dr. Sohal Ghul. We have 36 subcommittee chair people, so this Medical Advisory Board is comprised of tens and tens of practicing physicians from a variety of subspecialties, specialties, and subspecialties. Next slide, please. Let me say that both the board of directors as well as the technical advisory board and the medical advisory board are all unpaid volunteers who volunteer their time and effort to PCRF and the Palestinian children. So they are not compensated whatsoever. The medical advisory committee here, these are the functions, and you primarily being physicians should be interested in what the role is of volunteer physicians within PCRF, given that our mandate is medical. So their medical missions and treatment abroad programs, needs assessments are conducted, training and capacity building, vetting, physicians who are interested in going to Gaza and Palestine to serve Palestinian children and sourcing those volunteers and healthcare personnel. Next slide, please. Our staff and our offices and volunteers, again, are located in several countries. We have offices in the United States, Gaza, the West Bank, Jordan, and Lebanon. We had 3 offices in Gaza, all 3 of which have been bombed, no longer exist. However, our other offices are fully functioning. 5 staff members in the United States, as you can see from this chart, the majority of our staff are in Gaza and the West Bank, with several in Jordan and Lebanon. We do also have an office in Italy, which is also very active, and we have 3 staff members in our Italian office. We're legally registered in both the United States, Palestine, as well as in Jordan, and our organization in Italy. Next. We're very proud of our operational efficiencies and our 4-star rating with Charity Navigator, which is the premier organization that rates not-for-profits in the United States. We have the highest number of stars because of our efficiency and transparency in what we do. We are now at 2.5%, hoping to go to 2.25% operational efficiency, meaning that we strive to spend almost 80 cents of each dollar on our projects and not on overhead expenses. Next slide, please. Skip. Medical missions, again, that is our premier area and prime area of expertise and focus. We sponsor volunteer teams. We've been doing this for over 30 years, teams of doctors, nurses, and other medical professionals from over the world. We've had over 5,000 missions sponsored by PCRF. And areas of service include a wide variety of specialties and subspecialties, which are listed there. So there's room for everybody and for every specialty and subspecialty within PCRF. Next. We have a one-time surgery program, which are services for children in need of one-time surgeries in between missions. These are children who are going without care due to lack of access and lack of financial ability and financial means. We locate hospitals within the region who offer us reduced prices. We are able to have volunteer physicians perform the surgeries in these facilities at reduced prices. And it's basically serve and go. So the child has the operation, they go back home, and we continue to follow up through our medical missions as they arrive in either Gaza and Palestine, and follow up on the treatment of these children who underwent surgeries. Next. We have a treatment abroad program. That's another one of our main pillars. So children who require specialized treatment, specialized surgeries, where we are unable to perform these surgeries on the ground in Palestine, are then taken abroad. Usually it's been to the United States. Of course, there are many more children in need of being treated outside of Gaza. Because of the current ongoing catastrophe. So we're scaling up this program. But again, it's been one of our longest standing programs in Palestine since 1992. We've sent 2,000 plus children from all over the Middle East to the United States, a few to Europe and Asia for free medical care. Next. Pediatric cancer departments. We have the Huda al-Masri Pediatric Cancer Department that Her Royal Highness Princess Dina helped inaugurate back in 2013, as well as the Dr. Musa and Sohaila Nasib Pediatric Cancer Department that was housed in the Rantisi Hospital in Gaza. And last November, you all saw on your television screens that department was bombed along with the entire hospital. So that is no longer in existence. I don't need to tell you the need for cancer care and cancer treatment in Gaza. The children that were treated in our cancer department would have otherwise not had access to chemotherapy, drugs, or care. There was no other place in Gaza where they could obtain this care. It was almost impossible to get permits from the Israeli government to leave Gaza. And even if the child got the permit, oftentimes their companion or guardian would be denied a permit. And that made it almost impossible, oftentimes just increasingly difficult to get the child out of Gaza to another destination for cancer treatment. So of course, we will be rebuilding that cancer department in Gaza. However, the one in the West Bank continues to function nonstop, uninterrupted. Next. Education and capacity building. Each mission that goes does their part in training local physicians in new areas of medicine, new procedures with new equipment, ongoing capacity building. We intend to focus more on building local capacity within Gaza and within the West Bank in the years to come so that we can have a self-sustaining, self-sufficient healthcare system and infrastructure in Palestine. Next. Humanitarian programs, in addition to our medical programs, include the Gaza Orphan Sponsorship Program. We had about 450 orphans that PCRF was sponsoring and taking care of prior to October 7th. We are now looking at over 22,000 orphans and still counting just in Gaza. So the scope of the work and the scope of the tragedy as it relates to children who are now left without a parent or with one parent as opposed to the two they had is just unbelievable. So of course that program is going to see a scaling up and many changes. Food security. People were suffering from food insecurity prior to October 7th. The situation has just been exacerbated by the scope of the destruction and of the tragedy. And as we all know, famine has arrived and the people continue to suffer from food insecurity. But we did have voucher programs and food interventions long before October 7th. Next. Next. These are some of the photos you saw in the video. I'm not going to repeat what you already heard, but of course there's been several humanitarian aid interventions since October 7th, and they continue daily. Next. This gives you a snapshot here in terms of numbers of our interventions between October 7th up until March 23rd. So forgive me, but some of these numbers haven't been updated, and of course they've increased. I don't see the grand total here because my face is blocking the slide, but we're at about $22 million and some change in interventions, humanitarian interventions. We've broken it down for you here to see in terms of the project classification. The majority of the money, our donor funds that we are extremely grateful to have been spent on nutritional intervention and medical supplies. As you can see here, over 15 million in food and over almost $5 million in medical supplies. So there's also, I think it's broken here into Gaza versus the West Bank, because again, although the focus has been on Gaza and it needs to be on Gaza, we cannot forget the downstream effect of this destruction and carnage on the West Bank, on the refugee camps in Tulkarem, Jenin. People have been displaced, people are hungry, people are in need of humanitarian aid and assistance, and we have not forgotten about them. But there's about $350,000 in aid during this period in the West Bank. Next. Purchase location. Many people ask us, well, we hear that nothing can get into Gaza. People and organizations are suffering, they're complaining, they're struggling, and it's difficult for anything to get in. That is all true. However, what makes PCRF unique is that we've been on the ground in Gaza for the last 30 years. We've been purchasing and procuring, and we know vendors and we know where to go, and people trust us, and we can buy and get supplies without paying for them immediately. So our credit rating is excellent as well. So there are certain characteristics that PCRF possesses that others do not. We were able to procure and purchase over 84% of all of our food products from within the local Gaza market. And only 14% were from Jordan, and those were the medical supplies that were flown in through the assistance of our logistical partner, the Jordan Charity Hashemite Charity Organization, JCO, which assisted us in carrying via air 2.5 aircraft full of medical supplies into Gaza through Al Arish and then into Rafah, and distributed through the Palestine Red Crescent and the Ministry of Health to the hospitals that were still standing and functional at that time, as well as to the clinics. So for those of you who wonder, yes, most of our procurement did happen from within the Gaza market. Next. Medical and hygiene interventions. Again, this is the airlifting of the 45,000 tons of medical supplies from Jordan, and the other interventions that you heard of and saw in the video. Next. This just breaks it down for you in terms of what do we mean by nutritional interventions. We had rice meals. Hot rice was prepared by our staff in Gaza, 26,000. We distributed water, 243,000 kilos of vegetables, and vegetables continue to be distributed daily in Gaza by our staff. Flour, over 1 million kilograms of flour. UNRWA called PCRF and said, we got a shipment in flour into XYZ vendor. Can you purchase this flour and distribute it to those in need in the shelters? We said, of course, and that's what we did. Many of you may know that flour is a dual use product, and not everybody can bring flour into Gaza, but UNRWA was able. So they did the bringing in, we did the purchasing and the distribution in partnership with them. With our partners, World Central Kitchen and ANERA, we provided over 120,000 hot meals to those in need in shelters, as well as 54,000 kilos of raw meat. You see there our employee Fadi, who supervised the slaughtering day in and day out of these meat products that were then distributed. Next. Shelter and clothing interventions of course, blankets, mattresses, clothing, toys for children. We also distributed those such items. Next. As Princess Dina will speak more about, and she's a big proponent, and so is PCRF, of partnerships and collaborations. These are unprecedented times we could have never expected or anticipated, and we need to work with one another, with each other, to meet the need. We can't do it alone. And these are some of our partners, some of our collaborations. As you can see, we have the Ghassan Abu Sitta Children's Fund as one of them, and you'll hear more from him in a few moments. Next. What we're doing now. So here we have a field hospital in southern Gaza. This is augmenting a current hospital. We are expanding it with an additional 50 beds. This says that it's currently in progress, but it has now been complete and it's ready to be used. So we're very proud of that accomplishment. Next. We have a plan, and this has been a dream of PCRF for many years now, is to bring into creation, into fruition, a self-standing PCRF Children's Hospital. And we have begun negotiating with another not-for-profit NGO, Fajr Scientific. Our intent is to purchase a pre-constructed field hospital that would serve or have the capacity to have 120 beds. This facility will be used for 2 years for medical and emergency purposes, so not just for children. After 2 years, hopefully the need for such surgeries and emergency interventions would no longer be as high as it is today. We would then repurpose this hospital to become the PCRF Children's Hospital, and that will be the epicenter for all of our medical missions, all of our medical interventions, and also be a space and a place where other medical missions can come and conduct their missions there in that facility. This is an $11 million project, so no small feat, but again, people have been generous PCRF is committed to using those donor funds in Gaza as intended by the donors. And this is a project that will serve a need as we continue to assist and help rebuild the healthcare institutions and structures that have been destroyed. So we are fully invested in rebuilding. However, rebuilding brick and mortar is going to take time, and we need a quick fix, so to speak, in the immediate future to address the urgent needs that exist today. So we're going to be working in parallel. So by no means does a field hospital going to take the place of our commitment to help rebuild the hospitals that we used to work with very closely and perform our medical missions at. Next. Treatment abroad program, again, we've scaled up. Unfortunately, the need has increased exponentially. We have 6 children already in the UAE. 42 children have been evacuated to Qatar. I don't know what that says, 3 children. Anyway, there's a total of about 52 or 53 children total that have been evacuated from Gaza. We don't do the actual evacuation. We facilitate the evacuation. We take over the child when they arrive in Egypt. And from Egypt, they are already in place to go to a final destination to one of the third countries that are waiting for them. Highly reputable medical institutions in these countries who are offering their services for free. Of course, PCRF takes care of the logistics and the air flights and all of the ancillary and accompanying expenses that go along with sending a child abroad. And usually the child is sent with a companion, usually the mother. Next. I have to go back and say that many of the children with cancer that we treated at our cancer department in Gaza were evacuated in conjunction with St. Jude in Memphis, Tennessee, and in cooperation with the King Hussein Cancer Center Foundation in Jordan, who is currently taking care of these children with cancer that have been evacuated from Gaza through St. Jude. We resumed medical missions. Again, we currently have a mission that just left Gaza, another one going in about a week. We have a mission already in the West Bank. One just came back from Lebanon. So missions have resumed, and we intend to continue to have a minimum of 3 missions a month. We are setting up a hub in Cairo. We currently don't have an office in Cairo, Egypt, but as you can imagine, that's the place to be. We need to deal with the outflow of patients coming out of Gaza into Egypt, either being treated in Egypt or en route to another destination for medical treatment. So that is in the works. And hopefully we will have that set up. Our ongoing programs in the West Bank are continuing. We just opened in February an autism sensory center there. And recently, at the beginning of the month, just opened up an emergency clinic in a village near Bethlehem called Batir. Next. Moving forward. Okay, of course, our intention, again, cooperation, collaboration, partnership, 3 key terms here that you're going to hear on and off throughout this evening. We're going to expand our global footprint. We're, so pleased and blessed to have had BIMA reach out to us saying, what can we do to help? And there is much help needed. Medical personnel, medical institutions, we're going to expand our affiliations and partnerships, expanding our donor base, expanding our chapters around the world. So there is much work that needs to be done. How BIMA can support? Of course, many ways to support. Number 1 is to join a medical mission. To send us any interested physicians, nurses, medical professionals interested in serving in Gaza can send an email, and we can provide you, offline at a later time, with an email and provide that to your leadership within BIMA to send us your name, your CV, your specialty, your passport, all of your credentials, so we can go through the appropriate processes and include you and your colleagues in a medical mission to either Gaza, the West Bank, or Lebanon. So that's one way you can help, is join a mission. Next. Supporting the treatment abroad program, sourcing your institutions that offer free local care in the UK, sourcing healthcare personnel offering free care, sourcing education and training opportunities, because you're also advocates, you know, amongst your colleagues, amongst your medical institutions. Are there opportunities where you can amplify the voice of the Palestinian people, of the Palestinian patient, of the Palestinian child? Can you assist in sourcing partner organizations to help with patient housing and living arrangements? All of these are vital components in our treatment abroad program that BIMA and others can help with tremendously. Next. Supporting, again, awarenesses like we're doing today, conferences, webinars, lectures, particularly in medical schools and universities, amongst your own colleagues, the members of BIMA, and other organizations that you may be affiliated with or members with. Next. You know what, I'm going to leave this for our call to action, because we always have to talk about donations and money, because that is, you know, this is the way the world operates, and this is what keeps NGOs like PCRF and others afloat and able to survive. And we have ideas, and we will be talking about those later. So you can skip this for now. Again, I can't say it any louder or any clearer that the children of Palestine need you. We need everyone. We need humanity to step up, to do their part. And this is a start with BIMA. And we thank you. And I thank you from the bottom of my heart for listening and for reaching out. Thank you. So I'd like to introduce, and I'm not going to spend too much time on introductions because you all received the invitation to this webinar. You are familiar, at least mostly, with 2 out of the 3 of our panelists, because one is a household name and the other is also another household name. Princess Dina Murad may be new to many of you. She is certainly not new to Palestine, to Jordan, and to the region. She's not new to the world of cancer. Of course, she holds this title of princess, but I can tell you there is much more to being a princess of the people, as she is, than just holding a title. She is one of the most credentialed and experienced women I have ever been introduced to. We are fortunate to have her as the head of our technical advisory committee. I just want to highlight that she comes to PCRF as the former Director General of the King Hussein Cancer Foundation, where she served for over 15 years, was the past president of the Union for International Cancer Control, the UICC, but more importantly, she was the first Arab to serve in that role and the first non-medical professional to serve in this global role. She currently serves, again, as a patron of the International Society for Paediatric Oncology and the honorary president of the European Organization for Research and Treatment of Cancer. But most relevant to our topic tonight is her role as the head of PCRF's Technical Advisory Committee, and most recently has been appointed the head of the Advisory Committee for the Gaza Health Initiative, which she will introduce us to later. So again, we want to have this as an interactive conversation amongst the 3 panelists. And I just wanted to give you an overview of Princess Dina because she, you know, we do need to highlight her accomplishments as well. Next, we have Dr. Ghassan Abu Sitta. You know, I don't know what else I can say about him that you don't already know. He's dubbed Gaza's war surgeon, and he has become a household name to millions around the world. His accolades and accomplishments are too many to name, but the most recent is his overwhelming electoral victory as rector of the University of Glasgow, making Palestine immensely, immensely proud of the son of Gaza. And he will be joining in the conversation as well. Dr. Mads Gilbert, I can't say enough about Dr. Mads either. His name has become synonymous with humanity, strength, integrity, and unapologetic support of the Palestinian people. He is a fearless, fearless warrior, and much respect comes from Palestine to Dr. Mads. He has used his platform as a Norwegian physician to amplify the voice of the voiceless, the voice of a people who have been yearning for peace and justice for over 75 years, again, not just since October 7th. And we thank you, Dr. Mads, from the bottom of our hearts as well. So welcome to all three of our panelists. Let's begin the conversation. I'm going to start with Princess Dina, and I'd like you to share with the audience, Princess, about why you chose to invest your time and effort with PCRF, as opposed to the hundreds of other great organizations out there doing good work in Gaza and Palestine. Why PCRF?
Thank you, Vivian, and hello to all the esteemed panelists. Basically, the answer is twofold. One, this has been a war on children. It has been dubbed that. 14,500 children has been killed and murdered. And so many, over 77,000 people have been injured and maimed, many of whom, in fact, could be half our children. So that's one. And I've also had a history with PCRF since 2013. I was honored to open, as you saw in the slides, their first ever pediatric cancer department in Beit Jala, the Huda al-Masri cancer department. So it was a no-brainer that, with the scale of the atrocities and the situation at hand and children being orphaned, I really wanted to put my skills to bear to support PCRF, as well as I'm making myself available to support any other organization that is working also for Palestine. So that's why I have joined.
Okay, well, thank you, and it's a privilege to have you on board, Princess Dina. Dr. Ghassan, I mean, with the unprecedented targeting and destruction the world has witnessed against medical and health professionals and infrastructure in Gaza, do you see the needle shifting in favor of Palestine within the medical community?
Absolutely. I think within the medical community and most of our my colleagues in BIMA would attest that the health professionals have felt directly affected in this war, even those who are not directly linked to Palestine in any way, by virtue of their profession. The fact that Israel made the targeting and dismantling of the health system in Gaza central to its military strategy has really meant that health professionals have watched with horror the attacks on hospitals, the execution and murder of medical professionals, and the disappearance and stories of arrests and torture of health professionals. And I have felt personally touched by this, because as health professionals, they had felt that at least in war, that these institutions should be protected and these individuals and professionals should be left to provide the care that they need within these institutions.
Okay, well, thank you very much. One question here about the webinar being recorded. For those of you listening, the webinar is recorded. Any information you're requesting can be provided to you either through BIMA, and you can also listen to the recording. Yes, we are recruiting medical staff to provide assistance, and there is a mechanism for doing that. So absolutely, and thank you for that question, Sister Samira Ali. Dr. Mads, moving on to you. There's so many questions we can ask you, but I'm going to start by saying that you've been actively present throughout numerous wars in Gaza. This is not the first that has been waged against the people of Gaza. In addition to the unprecedented numbers of death and destruction that we all know about, and that's why we're not here to talk about how many have been killed and how many have been injured. We can get that information. It's readily available. We're here to listen to people who have been on the ground in Gaza, who are analyzing situations, who are making recommendations, concrete proposals, and I'm hoping you are one of them. But to go back to my question, you've been present throughout several wars. So in addition to these high numbers of death and destruction, what makes this current catastrophe unique, in your opinion, as someone that is very familiar with Gaza?
Well, first of all, thank you so much for having me, and thank you to Princess Dina and to you, Vivian, and to BIMA for arranging this webinar. It's so important that we take stock and look forward now, because my most important message is that we are going to rebuild Palestinian healthcare in Gaza, in the West Bank, under Palestinian leadership, to raise again, to be the kind of medical service that the people of Palestine really deserve. And that will take massive efforts. I'd like to quote what my brother Ghassan always says. He says, comparing to the previous attacks, they were floodings. What we have seen now is a tsunami, a man-made horrible tsunami of systematic attacking, not only the hospital services, but even more the primary healthcare services, so important to provide public health services to, in particular, the poor people. And don't forget that the people of Gaza had been suffering under 16 years of brutal siege before the 7th of October. So that malnutrition, anemia, poor living conditions, all of these factors as a result of the man-made siege and the lack of, sufficient supplies of food and work and income, and also the healthcare, made the civilian society almost on their knees when the attack started. So I think what is new to this attack is the brutality, the complete lack of humanity in all aspects, and the silence of the Western world. These factors combined, I think, aggregate to make a situation unprecedented in modern history when it comes to breaches of international law and breaches of just fundamental humanity and decency, how we treat each other. And I think that, one very important thing that we should not forget in portraying all the misery, to me, this has been the most impressive demonstration of Palestinian steadfastness and of the healthcare workers, the Palestinian healthcare workers in Gaza, and their willingness to sacrifice time, family, life, health, everything to stand by their patient and their people. And as I used to say, the moral compass of the world today is in the hand of the Palestinian people in Gaza and in the West Bank, and in particular in the hands of the healthcare workers, because they have shown to the world what it means to be a real human in face of this kind of atrocities and man-made disasters. It would be so easy to fly away, but they never did. They stood by their patients, and we have so much to learn from them. But I think now we need to focus on the future, and as you may know, the city arms of Gaza City is the bird phoenix, and I think that the healthcare in Gaza will rise as bird phoenix, but importantly under Palestinian leadership.
Absolutely, absolutely. And that's why PCRF is focusing on rebuilding what has been destroyed in terms of, some of the departments that we were very intricately involved with, as well as other departments at other hospitals, and building local capacity, building local medical and healthcare capacity. One question from an anonymous attendee says that considering that even Western aid workers are not spared, what safety measures are in place to help medics who volunteer for a medical mission? Well, I don't need, and I think Dr. Ghassan and also Dr. Mads will support me on this when I say that there is no such thing as a safe place in Gaza or an entirely safe medical mission, no matter how much we try and how many safety measures are in place. Medical missions through PCRF to Gaza currently are done in coordination with the World Health Organization, according to their processes, procedures, and protocols. And there is safety training. There's a briefing when you go in and a debriefing when you come out. There's security coordination that is done with all relevant parties, the Egyptians, the Israelis, etc. All that is in place. But certainly that does not prevent a horrific catastrophe to happen. And it's happened. MAP UK has had one such incident, and medical professionals are targeted, whether they're with the mission or outside of the mission. So we follow proper processes, procedures, protocols. We have the security coordination. We have the assurances from everyone that our teams will not be targeted. And then we leave it up to the grace of God. I can't say anything further. Dr. Ghassan, if you'd like to answer that question differently, please feel free. I'm going to turn it over to you. You also heard what Dr. Mad said about the unique nature of this catastrophe. Is there anything you'd like to add? Do you agree? Is there anything that he said that strikes you that, as wanting to highlight or underscore?
It's just, for me, what has made also not just the magnitude of this war different is that really this is the first war where the destruction of the health system is central to the military strategy. If you look at what the Israeli army, Israeli Air Force really has gone out of its way to do, is to dismantle the health system. And I use dismantle because it's not just about what started initially as the targeting of the health facilities, and then surrounding them, isolating them, and then with the land invasion, dynamiting the hospitals within the area where the tanks had reached, and all the way to the killing of over 400 and the wounding of 900 health workers, doctors, nurses, paramedics. And now this horrendous discovery of these mass graves in the compounds of the hospital. And so the centrality of this as a military strategy, I don't think has happened in any war anywhere in history. Health facilities have been attacked, but not as the main aim of the conduct of the war.
Okay. Yeah, understood. Princess Dina, you're listening, as we all are, to Dr. Mads and Dr. Abu Sitta, and you also have access to much information about what's going on inside Gaza. And with your current role as the lead of the advisory committee for the Gaza Health Initiative, how do you see the role of that institution or that collaborative organization in addressing the size and scope of what we're looking at in Gaza? What is your role, and what is the mission of this collaborative organization vis-a-vis what we're looking at and the scope of the destruction to the healthcare sector in Gaza?
Well, first of all, I think, given the scope of the atrocities and the scale of it, no one country or no one organization can deal with the rebuilding of health of Gaza alone. So I think this Gaza Health Initiative was started by a group of people. NAMA is one of them, and some organizers here in Jordan. It's an attempt to organize all the good intentions around the world. There's so many good intentions around the world of people really wanting to help Palestinians and Gaza in particular. And there has to be some umbrella organization that somehow tries to organize and understand who are the stakeholders, because we need so many collaborative efforts. One particular effort is being done right now is to actually build an IT platform, like a clearinghouse kind of platform that can help donors go into that platform to be able to know about the need, and to be able to also see what piece of that need they can actually take on and support it without duplication of efforts. It's still being, as we speak, being built. They are working on it with some geniuses in IT and so on, to really support us all in becoming the platform for everybody to know, what's happening, who's doing what mission, etc., and so on. So inshallah, this will be up and running soon. And we're all trying our best to do something in our role, and most importantly, to collaborate. For example, Dr. Ghassan Abu Sitte, he has his own foundation, the Children's Fund, the Ghassan Abu Sitte Children's Fund, and yet he also availed himself to be on our advisory board and so on and so forth. And this is the kind of collaborative effort that we need. There is no time to be competing, but we need to organize so we don't duplicate efforts and to join forces together.
Thank you. So this platform or this clearinghouse of information is meant not for donors, but for volunteer organizations, for people that are part of the collaborative, to go in and see what piece of this great need they can assist with, and to coordinate efforts so that we don't duplicate them in this rush of goodwill and help. So that
also
is
for donors, also for donors.
donors.
It's going to
Okay.
be for multiple targeted groups. So it'll be just an information, live information hub, so people can know. Inshallah, it will be up and running.
Okay. So for donors who want to donate to a specific initiative, would have the opportunity to see what's going on and put their money where they intend it to go. Okay, great, good to know. Thank you, Princess Dina, for your effort, and I'm sure we are all happy to support you and the Gaza Health Initiative in any way. So thank you very much. Dr. Mads, you're one to take on a challenge and have done so historically. What are some of the challenges that you've encountered, since October? Some, challenges that have, raised your eyebrow a bit. And how can we help you overcome such challenges and what you aim to do for Gaza?
Well, thank you for that question, Lilian. I want to pay tribute to the local PCRF staff. I've been working with PCRF since around 2011, and Mr. Sahil Fleifel has always been my boss in Gaza, and pertinent to the question of safety. I've always felt very safe under Sohail's leadership and careful follow-up on every aspect. And he's in Gaza. I hope he's listening in now. His daughter, Nada, the dentist, has been, recruited, and also Karima Tuman, young medical doctor from Al-Azhar University, been working for you in Cairo as a coordinator. So this fantastic flexibility of the PCRF staff on the ground in Gaza has also impressed me very much, both the hospitality, the security, and the efficacy of PCRF in Gaza. And I think PCRF will be indispensable for the future of the kids in Gaza. And I am quite fearful of not so well-willing effort from the occupiers and from the US government to actually hold off and to take over the civilian society functions in Gaza with Trojan horses, to put it that way. So I think I will repeat again that I think all initiatives should be discussed with and agreed with the Minister of Health. There is now a new Minister of Health in Ramallah. Dr. Youssef Abarish is a very staunch and patriotic and steadfast leader through this last 8 months. And I think if we now flood Gaza with field hospitals from different organizations, not as experienced as PCRF, we risk that we have two parallel systems, and we can get a situation like in Afghanistan, which is very unfavorable for the long-term development of a Palestinian conducted and led healthcare system. And for the children of Gaza, we should not forget that there are 180 deliveries every day. As we are speaking, there are more than 20,000 newborn children during these 6 months. Almost all of them are underweight, low weight newborns, and the women giving delivery in a heroic way are void of clean water, hygienic things, and many of them have to deliver without a midwife. So there is a very, very urgent need to protect the pregnant women, the newborns, and the nutrition of these groups, and to refeed people who have been starving is not just about getting in calories. It's about a medical directed, careful step up of the food, the feeding process. So PCRF will be needed to actually engage in long-term planning of the protection and medical care of the children, not only the wounded and those needing special treatment, but the pediatric population at large in Gaza, who will remain in Gaza, who will not go abroad for some specialist treatment. And we should not forget that public health will be, by and large, determined by the access to water, food, protection, and preventive medical care. And I think maybe PCRF could step up the planning and the efforts to also engage in the not only the curative but the prevention medical care for kids in Gaza.
Absolutely. Yep. Thank you.
As for myself, you know, my main problem is that the charming Israeli occupation forces have by name said that I will not be allowed into Gaza. I've tried for 3 months to get in, but I've done what I can with Hashemite Court and with other good people on the outside. But they are actually actively denying people access who they find critical of the occupation. But that's another problem.
Another problem, and yeah, absolutely. But that hasn't prevented you from continuing to advocate and to do what you can from the outside, Doctor. Thank you. That's a good segue into another question that's been asked in the chat group by no name here, anonymous attendee. What is the situation with palliative care provision for patients with end-stage illnesses? Many of us won't be pediatric trained. Would PCRF still wish us to apply for medical missions? You know, Dr. Mads just finished talking about priorities in the healthcare, you know, system. So, you know, there's certain things that we're doing now, which is urgent, you know, treating the injured, keeping people alive. Our intervention as PCRF has been nutritional intervention and medical intervention for immediate care. Of course, there's other areas that, you know, require services, and specifically palliative care should be, you know, one of them. Is this something that PCRF is doing, especially at the current time? The answer to that is no, because it's not pediatric, so to speak, related. But certainly those that are in that area of specialty that are interested to go on missions, to serve in Gaza at some point in time where it's going to be possible to send in missions of the sort, I would encourage you to reach out to PCRF. And if PCRF doesn't have a mission for that particularly, there's certainly other organizations that we work with and partner with that do. And we will coordinate a mission with them and allow you to serve as you are asking. So thank you for that question. And I know we're over here, but we've been allowed to go a few minutes over. Dr. Ghassan, one last question to you. The solidarity Gaza has witnessed from ordinary people in the UK has been incredible, with hundreds and thousands taking to the streets continuously, and we've witnessed that on our television screens. With that said, how do you see the specific role of physicians and healthcare providers in the UK who want to help? And where do you think they need to concentrate their efforts during this time?
I think by virtue of talking about tomorrow in Gaza, we are resisting the erasure of genocide. And then when we move forward to planning tomorrow in Gaza and working towards healing the wounds of Gaza and its people, and actively thinking and working together and mobilizing communities and maintaining this kind of support, so that tomorrow is about Gaza, and that tomorrow, as I always say, tomorrow is a Palestinian day. That in itself is the biggest resistance to the finality of genocidal erasure. And therefore, the ordinary people across the globe have been outraged, and rightfully so, and more importantly, have felt personally targeted by this genocidal war, because it's an affront to their humanity and their identification with fellow Palestinians and their shared humanity with fellow Palestinians. Of course, in the UK, the Muslim community has led the way in mobilizing and reaching out and being at the forefront of this civil society and popular mobilization. And I think this will continue. I think that the 75 years of impunity that has allowed Israel to carry out massacres throughout the history of its assault on the Palestinian people has come to an end, and the people across the globe see Israeli settler colonialism for what it is. And so we talk about tomorrow and we plan for tomorrow, not just because that's what we do as health professionals, but because this is the antidote to the finality of genocidal erasure.
Okay, thank you. One question about allied health professionals. How can they get involved with PCRF's work? Dentists, pharmacists, nurses. Every mission that goes into Gaza needs a nurse or two. Okay, so nurses are immensely needed, even more so than physicians. We get more physicians than we're able to bring on missions, but not enough nurses, number one. So absolutely, nurses are needed. Dentists, we just had a medical mission of dentists leave Bethlehem. So they were servicing children in need of dental care at the hospital in Beit Jala. So dental missions have gone in and out of Gaza. Of course, dental missions aren't going into Gaza now because there's a more urgent need at the moment, but definitely in the West Bank, if there's dentists listening to me now and you're interested in going on a mission, a dental mission to the West Bank, we can certainly use you and we need you. So please reach out and let us know who you are and when you're available to go. And we will send your information to our medical advisory board, who will then coordinate. So absolutely.
Can I add something, Vivian?
Sure,
I
yes.
think the critical nature of recruiting from within the National Health Service in the United Kingdom is because the NHS has always, is actually much more advanced in terms of nurse-led services, and therefore advanced nursing care is much more prevalent in the United Kingdom and is exactly what is needed. And when you think about the amount of rehabilitation in terms of physiotherapy, occupational therapy, hand therapy, all of the other allied professions that are extremely advanced and subspecialized by the nature of the kind of NHS and the way NHS promotes subspecialization is absolutely critical as both providers of care and trainers of Palestinian health professionals.
Yeah. Yes, yes. Thank you. Thank you for interjecting and saying that. Very, very important, Dr. Abusetta. An interesting question from a doctor and lactation consultant. So a question of how you can collaborate with doctors and lactation consultants who have started an initiative to support breastfeeding in Gaza for infants less than 6 months old. That never crossed my mind. Very interesting. And I'm sure there's a huge need. This is something we would love to discuss further. So please reach out. You can reach out to me initially directly at vivian@pcrf.net. And I will certainly send you the appropriate contact person to continue discussion on this initiative. So thank you for that question. Questions about training healthcare professionals in Gaza, of course, that is one of our main areas of focus. Again, training is not something we can do at the moment in Gaza. This is for tomorrow. As Dr. Ghassan so eloquently said, we have to plan and talk about tomorrow because there will be a tomorrow. And I'm just quickly going through these questions. Is there a pharmacist? We do not have a pharmacist lead for PCRF at the moment, but we will soon, and you will be able to access who our leads are, who our chairs are for each of the specialty and subspecialty teams within our medical advisory board through our website. So there will be more to come on that. Somebody wants to hear from BIMA how to collaborate, but I think I am going to ask any of the panelists if they have any last minute words to say, anything they wanted to say and I didn't ask. And then I'm going to turn it over to the princess so she can tell us what we need and how you can help, and to give us the call to action that she does better than me and many of us in PCRF. So anything, Dr. Mads, that you're just itching to say?
I'm itching all over the body. No, I just want to say it may be self-evident, but I am extremely anxious of what is going to happen the next weeks. So I think from a medical point of view, the most important thing still is an immediate and lasting ceasefire.
Yeah.
The attacks, the killing, the starvation has to stop. That's number one. Number two, Gaza must be opened fully. The trucks are standing there. They're not allowed in. All these excuses and peer building and all that is political tactique. So we must demand immediate ceasefire. We must demand an immediate opening of Gaza. And we must make sure that the situation for the summer is focused. I had a long conversation with the Minister of Health, Dr. Youssef Abarish. He had 3 points. Number one, the only 20% hospital capacity. We need to rebuild, repair, and reopen the Palestinian hospitals as soon as possible. They're not that damaged. There's much a lack of water, fuel, and medical supplies and teams. Number two, he was very concerned about the summer because of the lack of water and hygiene, pesticides, and antibiotics. So he feared an explosion of hepatitis, of meningitis, and other contaminating diseases. And the third thing was that if the Israelis are attacking in Rafah, there will be no hospitals available for the wounded, because Gaza European will be cut off. These were his three main concerns, and this is mandatory for any profession, all of us. It is to step up the solidarity work and the advocacy work to have a ceasefire, and the best thing we can do here in Norway is to push our government to impose sanctions until there is a ceasefire. Thank you.
Thank you for saying that. Thank you. Dr. Ghassan, anything I missed with you?
I'm okay. I have the honor now of addressing the students encamped in Columbia University. So I need
Okay.
so I need to make my goodbyes, and I look forward to speaking at the BIMA Congress in this summer. And so thank you so much for inviting me.
Thank you for joining us. Thank you. Bye-bye. Princess Dina, you're going to have the final word here. We're going to save the best for last, so please.
No, I think thank you so much for whoever thank you, BIMA, first of all, for making yourself available to wanting to support the Palestinian people, and especially in Gaza. As you have heard, first of all, we're all here because we all know that there is no option to do nothing. And we also know that there is power in the collective. Everybody can do something in their own role, and I know it will snowball into something impactful and positive. You know, the cat is out of the bag. We have fantastic demonstrations from students in the US, from people on the streets. It's been really heartwarming to see that. You know, my mother has dementia, and I'm so glad she has, because she would have been so heartbroken to know what's happening in Palestine. My mother comes from Nablus. But I have, when she had some moments of clarity, I have shown her the demonstrations that people are walking the streets and they're saying free Palestine. She couldn't believe that. So things are moving. People are doing everything in their role. And we need money, you know, to do all of these things that we spoke about. The scale is so big. You know, I would love for everybody who's listening to this webinar, it's so easy to support. You know, instead of going for your cup of coffee, 1 cup of coffee a month, think about Palestine, donate that cup of coffee. $15 a month, you know, these regular sustainable donations, however small, don't think they are small. They really become a tsunami of support. Imagine if 50 people in your organization, each one today decides to go and convince 10 people of your friends and family to go and donate, get their card in their privacy of their home and donate $15 a month. Then we become 500 people. 500 people times $15 a month times 12 months. Suddenly we have 90,000 a year. And imagine if we double that and you convince more people. So we really need that support. And I always say also, not only PCRF, support UNRWA, support Ta'awan, support the Gaza Abu Sitta Ghassan Abu Sitta Fund, support MAP UK. Make a care package of these $15 a month for each one of this organization. We need all the support so we can plan and really try to fulfill all the things that we want to do to help the children of Gaza and the people of Gaza. I hope this, the children of Palestine need you. There's so much to be done. And really, I want to thank you from the bottom of my heart for making yourself available and wanting to support. So thank you very much. And thank you, Dr. Maz, Dr. Ghassan, and Dr. Salman and Vivian for an amazing
it's you that is amazing. It's Dr. Mads, it's Dr. Abu Sitta, it's the local healthcare professionals and providers, first and foremost, on the ground in Gaza, as Dr. Mads so eloquently.
And they should get the Nobel Peace Prize.
They should.
All of them.
Get the Nobel Peace Prize.
Everybody.
Yes. And
otherwise, it's a nonsense organization. If they don't give a Nobel Peace Prize to the healthcare workers or the journalists as well.
And the journalists.
Dr. Mads, then we will be very upset with Norway. If that's
and I know, and I just wanted to show you that I'm in a small village on the west coast of Norway where we had a meeting on Gaza, and we continued the meeting with this webinar, and this is the audience, beautiful local people. Decisive day, municipality council here has voted, and they have decided to boycott Israeli goods and services in this community. So it's happening all over, not only in Colombia, not only in Yale and the other universities. Norway is standing up for Palestine, and we will continue.
Thank you, Norway. Thank you, Norway. And thank you, Princess Dina, Dr. Mads, Dr. Abu Sitta, first and foremost, the BIMA, Dr. Waqar, and all of your colleagues. Thank you for hosting us, for having us, and we look so forward to working with you in the days, months, and years to come. And I'm going to turn it back over to BIMA, our hosts, and they can wrap it up. And thank you to everybody that took the time to listen to us and to go over our scheduled period. Thanks.
Thank you.
Thank you so much. Thank you for those wonderful presentations. And I'm sure people will be incredibly happy to hear the amazing work the PCRF are doing, and I'm sure we'll be keen to support not only with their money but also with their time and also expertise. I just wanted to say to colleagues, thank you for your patience as we ran slightly over. For those of you who do want to learn more, we will be contacting you by email with a little bit more information, including how you can get more involved and address some of the questions that we weren't able to answer. But all that's left for me is once again to thank our amazing panelists, Princess Dina, Dr. Ghassan, and Dr. Mads, and also Vivian Khalaf for her amazing stewardship of the Palestinian Children's Relief Fund. And on behalf of all of us in BIMA, have a very pleasant evening. And thank you to all our colleagues in Norway who were listening. That was a very nice surprise at the end. And I hope you have a wonderful rest of the weekend. Thank you all. Take care. Assalamu alaikum wa rahmatullah.